Good evening, one and all. The respected speaker of today, Dr. Riaz K.M, and our respected principal ma'am, Dr. A. Tamil Selvi, and organizing team, Ms. Shika and Ms. Mamta, and all the teaching faculty and the students of Amity College of Nursing and the delegates of today's session from all over the country and abroad also. So the speciality of today is this week we are approaching to the International Mental Health Day. And for that aspect and also the corona pandemic, the COVID-19 pandemic is bringing all professionals coming under the screen in a virtual platform to discuss, to support, to help, and also to motivate the students and other professionals. So, on behalf of that one, on the occasion of that one, Amity College of Nursing is organizing national webinar series on nursing care perspective, paradigm shift during COVID-19 from today 6th of October to 9th of October 2020. So I would like to say thanks to our Honorable Vice Chancellor Dr. P.B. Sharma and Pro-Vice Chancellor Dr. Padmakali Banerjee and all the team who are supporting to organize this webinar, the management of Amity University, Haryana, and everyone. I would like to welcome to this webinar. So I request Dr. A. Tamil Selvi Madam to give a welcome speech and also unveil the theme.
Thank you, Naveen. It is a very proud moment to organize this webinar series, national webinar series. Really, we all know we are all at home due to this corona pandemic, but we are leading a new normal life. So this is also a normal, but this is a new normal life. We are leading it, and we are learning to live with coronavirus, and we are learning to fight with coronavirus. So there are so many things are happening at different level. So, and Amity has taken an initiative to organize and many webinars to enlighten the public and professionals to improve their knowledge as well as their ability. There are so many webinars are organized. So in this regard, and from October 6th to 9th, Amity College of Nursing is organizing this webinar. And I would like to thank our eminent speaker, Dr. Riaz. Really, it is a very proud moment to have him as a resource person. And I express my sincere gratitude to him to accept our invitation graciously and to have this session. So thank you, Dr. Riaz. Coronavirus disease, it is an infectious disease caused by newly discovered coronavirus. So most people infected with COVID-19 virus will experience mild to moderate respiratory illness and recover without requiring special treatment. Older people and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease and cancer are more likely to develop serious illness. The best way to prevent and slow down transmission is to be well informed about COVID-19 virus, the disease it causes and how it spreads. Protect ourselves and others from infection by washing our hands and using an alcohol-based rub frequently and not touching our face. The COVID-19 virus spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs and sneezes. So it is important that we also practice etiquette. For example, coughing into flexed elbow, and stay informed. And Government of India is taking all necessary steps to ensure that we are prepared well to face the challenge and threat posed by the growing pandemic of COVID-19, the coronavirus. With active support of the people of India, we have been able to contain the spread of virus in our country. The most important factor in preventing the spread of virus locally is to empower the citizen with right information and taking precautions as per the advisories being issued by Ministry of Health and Family Welfare. With this brief introduction, I would like to hand over the session to Dr. Naveen to welcome. Thank you all.
Thank you so much, madam.
Please welcome Dr. Riaz.
Yeah, it was a nice introduction and also unveiling of the theme. And to support your words, I will also appreciate the presence of Dr. Riaz sir, and it's our blessing from such an eminent personality. I just take 2 minutes to introduce about himself. Then I will hand over the session to Dr. Riaz sir. Dr. Riaz K.M. He is completed PhD in mental health nursing from National Consortium of PhD Nursing, Indian Nursing Council, and WHO, and Rajiv Gandhi University of Health Science. And he completed postgraduate diploma in counseling and MSc in mental health nursing. And he has a very good topic, and it was a useful topic of PhD thesis in Alzheimer's disease. And he was a research guide for 3 students from various universities. And he is having a work experience, teaching and research experiences, and administration experiences, and staff nurse experience. More than 15 years to 20 years he is having experience. And he is having membership in, I would like to mention, 24 associations. He is having a membership in 24 professional bodies, and not easy for nursing professionals to have this many numbers. Sir, it's very good number, sir. Then sir has wrote one book chapter, Essential of Psychiatric Nursing, and he is having some project work running under governmental, under non-governmental organization. He is also have submitted technical reports, and more than 20 conference presentations he is having, and he attended more than 25 conferences, national and international conferences, 6 papers presented, and 10 papers published. So I have lot of things to say about Dr. Riaz sir, but we are having a time constraint. So thank you so much, sir, for coming and blessing us, and also sharing your valuable ideas and knowledge regarding government inventiveness and management of COVID-19. Thank you so much once again. Sir, please, I'm handing over to you, sir. You can proceed, sir.
Okay, thank you. So he has introduced me like what all things are written in my CV. But right now, I would like to introduce myself as a counselor. As a counselor for around 40 patients daily. Today also I finished 40 telephonic counseling. Before that, during the time of lockdown, 22,000 elderly could identify in Thrissur district in Kerala, and I was the convener for that telephonic support for elderly living alone. 22,343 actual number. And Madam was rightly saying that most of the faculty or nursing faculty nowadays are in home, but from the first day onwards, we as a team, government nursing college teachers, are in forefront of fighting with the COVID. Presently, I'm working in an institution which is a COVID hospital. Around 1,300 patients are there right now, and daily we are making contact with them. a lot of things I could learn. Actually, this pandemic has taught me a lot. So in this session, I would like to share some of the government initiatives taken by our government, both the central and state government, to contain this problem of COVID. So as you know, clusters of pneumonia were being reported from Wuhan. At that time, nobody thought it would come to my doorstep. Chinese authorities have identified it as a new coronavirus. And as we know, different types of coronavirus are there. Some are fatal and some are not that much fatal. Some can cause mild cold-like symptoms and some can cause MERS and SARS. Human to human transmission is variable. And some virus can transmit between people. And this spread of this virus later reached all the countries presently. India's first positive case of novel coronavirus disease was reported in Kerala. And interestingly, that was in our institution. India's first COVID case was admitted in our hospital. She was a student from Wuhan. And as of June 30, 2020, around 4,189 cases were there. But now the number game is over. Nobody is bothered about number nowadays. Now the number is, or now our focus is to reduce deaths, reduce problems associated with COVID. So this was the initial meeting, photograph of the first meeting among government officials that happened in Kerala, in Trivandrum. Interestingly, every day, evening, this is happening. All the officials, all the political leaders, and officials from various departments are assembling and they are sharing, and our chief minister is sharing day's progress, concern, and tomorrow's plan. And for this, we had some experience. Disaster management was little bit active in Kerala because of the flood that was in 2018 and Nipah outbreak in 2019. Because of this Nipah outbreak in 2019, infection control activities were in full swing, and we were giving training for staff nurses with the help of those staff nurses who actually dealt with the Nipah virus. And most of the nurses working in government hospitals got that training of infection control, especially viral infection control. That was a great achievement. And based on that experience, we started fighting with the coronavirus. And our state used innovative approaches and its experience in management, like experience in management in flood, as well as Nipah. It was the key factor that helped our state to fight with this COVID. And the comprehensive response in collaboration with the key stakeholders were conducted. In that, active surveillance, setting up of district control room for monitoring, capacity building of frontline health workers, risk communication, strong community engagement, and addressing psychosocial needs of vulnerable population. These were the highlights. These were the main points. Initially, our health department or our government was focused. How effectively we can do the surveillance activity. How much we can conduct this established district control room. And capacity building, that was excellent because we had experience, and through which all healthcare workers, different cadre healthcare workers were getting training how to deal with this issue. Then capacity building was the excellent aspect that I must stress upon. Then risk communication. Even social media was also using for this risk communication. A particular area or particular group of individuals are at risk, like that. That type of communication was very effective during initial period. Then strong community engagements. Even healthcare volunteers are nowadays working in our hospital. Those who don't have any healthcare, health-related preparation, even then they are caring, they are supporting, they are volunteering themselves for the welfare of people who are affected with the COVID as well as their family members. Then psychosocial needs. I already told you, during the time of lockdown, around 2 lakhs elderly living alone could identify. They are at home, they are not in institution. And in Thrissur district itself, I could get 23,000 elderly living alone, and support were given for such individuals. And of course, migrant population. A lot of migrant, actually we must call not migrant population, we must address them guest population, guest workers. And a lot of people were working from North India, and they were well managed initially because of this concept. And a high level committee was formulated in our states, with the chief minister, health minister, chief secretary, and principal secretary. And this principal secretary was the chief of state control room. Under him, mission director, that is National Health Mission, was there, director of health service and director of medical education. Two strong pillars in Kerala related to COVID fight, director of health service and director of medical education. And myself and me coming under this director of medical education, and a lot of activities are planned and implemented with the help of director of medical education. First step that we have taken, early release of technical guidelines. Initially, nobody was aware what to do, how to do, when to do, because this is a new situation, unique situation. Everybody were in dilemma. So early release of technical guidelines was the first step that we could do. In that, guidelines related to contact tracing. Even now, we are doing the same thing, contact tracing. I will come to that a little bit later. Quarantine, isolation, how to do this quarantine, how to isolate individual, actual patients, and as well as primary contacts, secondary contacts. Hospitalization, how to do this hospitalization, where to do this hospitalization, which hospital we can adopt. So many issues were there initially, but because of the technical guidelines released in initial step, it went on peacefully. Then infection prevention and control, technical guidelines related to infection prevention and control. Then extensive capacity building for all cadres of health and interlinked departments played a critical role in managing the situation. That was the first step taken by the government. And this is the website. You can see number of phone numbers, all are associated with the COVID related activity. Our daily new videos will be put in our website, health department website, and health minister will address various topics in different ways. And it is in an effective manner with which she can convey her concern, her views to the public. And this was the initial activity, initial campaign that was taken by the government, break the chain. It was very effective. Even in bus stops, people were keeping water and soap so that those who are entering into bus and those who are getting down from the bus can wash their hands. Before going to shops, they can use this one. So break the chain campaign was the initial campaign. Even now, it is running successfully. Another campaign taken by Don't Spit, because as Madam told, it is through the secretions that can definitely, the secretions from the mouth can definitely propagate the spreading of this virus. This was another thing, public awareness. And this was the inaugural session for the public. Every nook and corner of towns, were decorated with these type of information, awareness, so that public get more information and awareness regarding all these campaigns. That is the inaugural meeting that was carried out by Health Minister. And as this was the history, this is the history actually. But if you see October 4, 2020, 2 days back, this is the condition. The things are getting worse and definitely it is getting slipping out of our hand. Last day, it was 8,553 cases were reported from Kerala. And most of these cases are spreaded by contact. A total case in Kerala is now 2,29,886. It's a big thing. Initially, we could contain the virus, but later on, we couldn't. And this is the first guidelines issued by Department of Health and Family Welfare. And you can see that is on 26th January 2020. Then itself, we could release these guidelines. At this time, at this point of time, nobody was that much concerned about coronavirus in India, but we could release these guidelines. And these are the conditions, these are the things that is included in that one. A background is there, what is this virus, how it is getting, all those basic information is included in that one. Then clear specification, case definitions. Then how to screen, early identification, notification of suspect and probable passengers. Because at that time, only thing we are concerned was it is coming from China or those who are affected from those passengers who are traveling from those affected countries. So passengers were the prime focus at that time. Safety precautions during sample collection and transport, sample collection and transport guidelines, laboratory diagnosis, pre-hospital preparedness, algorithm to be followed in case of suspected coronavirus case. Suspected at that time, it was not that much a problem for our health. If a suspected case is coming, what to do? That's clear-cut algorithm was depicted in that guideline. And management. Principles of infection prevention control strategies associated with healthcare with the suspected coronavirus. Surveillance and contact tracing guidelines. And SOP for field surveillance of asymptomatic passengers. And guidance not to travel and tourism industry. As you know, Kerala is a state which is very much depending upon revenue from tourism. So in that guidelines itself, a clear specification was given or clear-cut information was related to how to manage tourism industry. That was also included in that guidelines. This is the algorithm in case of suspected case, how to manage this coronavirus. And next, 1st of February, criteria for hospital-based activities were published. Clear-cut, what to do with asymptomatic patient, what to do with symptomatic patients, categorization, all those things, criteria for hospital-based activities were depicted in this press release, or government order actually, not press release, government order that was released on 1st February 2020. This is related to revised guidelines for surveillance. As you know, it's a new virus, new disease. Nobody was aware about how much is the problem. So day by day, updating was going on. So revised guidelines were issued on 1st February, 26th to 1st February. In that short period, change was happened, and that included in this revised guidelines for coronavirus surveillance. Then government constituted a state and district level medical board. In state level as well as in district level medical board, these many people were included. That is HOD general medicine, HOD respiratory medicine, HOD anesthesiology, HOD infectious disease, HOD microbiology, and community medicine. And specific instructions were given, any change in medical management to be done in consultation with the medical board. That is the core thing. If a patient is admitting today in a government hospital, he is not treating by a single individual. Through telemedicine facilities, this medical board is deciding how to treat, what all modification we need to. So from initial stage itself, This was the practice done. That TOT for state level committee, that is important. Training of trainers, because capacity building was the prime thing, important aspect that our government focused, and TOT started, and guidelines for that TOT clearly mentioned. And committees were formed. And these were the state level coronavirus control room teams. You can see surveillance team headed by a particular individual. He will be looking after all the surveillance activity in Kerala. Call centers management team, HR management team, training and awareness generation team, material management team, infrastructure management team, media surveillance team, media management team, documentation team, private hospital surveillance team. That is important. Actually, last month only, private hospitals were included in the treatment of coronavirus in Kerala. But initially itself, they had a plan related to how to incorporate a private hospital for this purpose. So that team was working initially itself. Expert study coordination team, transportation and ambulance management team, interdepartment coordination team, field level volunteer coordination team. I told you, volunteers are nowadays effortlessly working day and night for supporting patients affected with corona as well as their family members. Psychological support team, mental health team. I was a part of this team, and mental health team effectively, district mental health program, effectively conducting psychosocial support program for those who are affected, those family members or affected individuals are giving. Then community volunteer coordination team, data management team, and finance management team. These were the state level coronavirus control team. And even today, they are working effectively. State Rapid Response Team also established, that it was in 3rd February 2020. You can see, apart from various medical experts, 3 more individuals were included. You can see, Director of Animal Husbandry, Drug Controller, Joint Commissioner of Food and Safety were included in this State Rapid Response Team. Because initially there were we were suspecting that it can be it can be transmitted to animals, and animal can transmit this one to a human being. So care were given, care was taken related to control transmitting this coronavirus to animals. So that is why this animal husbandry team. More than that, stray dogs. Initially, during that lockdown period, almost all hotels were closed. So most of the stray dogs may not be getting food. If they are not getting food, they can turn to violent. In order to control that, our animal husbandry department provided food for even for stray dogs. That much planning was there with this state rapid response team. Drug control, as you know, Joint Commission of Food Safety, because Kerala is a state where food is coming from Tamil Nadu, Andhra, Karnataka, and all. So we must ensure adequate supply of food. So that is why Joint Commission of Food Safety was also included in State Rapid Response Team. This is the guidelines issued by Animal Husbandry Departments, and their objectives were identify pet animals like dogs, cats, and other animals with the help of assistance of LSG, local self-government, and volunteers. Quarantine these animals at the site itself till the period of isolation of family members ends. Identify volunteers and other resources for feeding fodder and water to be quarantined animal, quarantined animal. The veterinary officer at the panchayat level also do monitor the health of animal. People caring for pets, domestic and farm animals should observe personal hygiene. In this regard, I will share one experience yesterday I had. As part of this mental health support, I called one lady, 52-year-old lady. She is actually living with her milk production from their cows. Because of this, she is now in quarantine. a person was coming for milking this cow, but because of this quarantine, nobody is coming to help her to milk the cow. If she is not milking this cow, and if this milk is not sold in the markets, she will not get daily that amount. This was a concern. Yesterday she conveyed to me. Then I contacted this local self-governments, and they could arrange a person, and both that cows and that individual is now happily living there. What I'm trying to say is our animal husbandry department, even our animal husbandry department is working hard to solve the problem of the public. This is the preparation. This is the material they prepared for conveying or for sensitizing the public. Then initially we started, whole district started with new isolation facilities. One district hospital and one medical college will be linked as a nodal center. And you can see in Thrissur, that is MCCH Thrissur, where I am working, it's a COVID hospital. So all district, this type of hospitals were identified and converted to COVID hospital. With regard to tourism department, I told you Kerala is very much depending upon the revenue coming from tourism, and specific instructions and guidelines were issued for this tourism department also. And this is regarding the policy, biomedical waste management. Clear-cut guidelines were issued to contain this virus. Clear-cut guidelines to manage the biomedical waste. That is based on this guidelines. For risk assessment and discharge of patients, clear-cut guidelines were issued. That was in 2nd February 19. Actually, at that time, there were very few number of corona cases or COVID-19 cases at that time. Then clinical categorization. Clear-cut guidelines were issued. That was in March 12. Clearly, patients has to be categorized as category A, category B, and category C, depending upon the level of symptom what they had. And based on that, management is also there. For category A, supportive management. Category B, informed disha. That is the specific numbers are there that we can call them, and they will provide information related to anything and everything related to COVID. And symptomatic management is also recommended for category B. And for category C, COVID-19 centers are there. Identified COVID centers were there. And from there, they will get the category C, people will get the treatment. And based on this guidelines issued in 2nd March 2020. And clear-cut guidelines were issued to flight and airport management. Because another revenue for our state is from abroad. Many are working abroad, and people started coming from abroad because most of the European countries and the Gulf countries were affected with the coronavirus. So government issued clear-cut guidelines how to manage this individual. So flight and airport management guidelines were issued. Management of foreign tourists. So many tourists were trapped here. And after the issue of clear-cut guidelines, even British government sent their aircraft, and they took many foreign countries conducted such evacuation activity from Kerala. And based on these guidelines, all these things happened. The National Task Force for COVID-19 by ICMR, clear guidelines were there. So this is the order that was issued by the ICMR. In that, chemoprophylaxis using hydroxychloroquine for asymptomatic health workers and asymptomatic primary contact persons were instructed. But care were taken to reduce the spread of false impression, because at that time there was some misconceptions among even from the healthcare workers that hydroxychloroquine is effective, and that was based on this specific ICMR guidelines. All these things happened, and it was carried out effectively at that time. And this is the social distancing that we planned initially. A lady is collecting rice from the ration shop, and she's maintaining that social distancing. So that type of social awareness program were conducted initially. That was effective initially. Then clear-cut guidelines were issued to saloons and beauty parlors. Government issued this guidelines to have enough sanitizers, single-use clothes, personal hygiene, spacing, restricting the number. All these guidelines clearly mentioned what to do in a saloon or a beauty parlor. That was very much effective for containing this virus initially. Then guidelines for shopping malls. Hand washing facilities should be there, social distancing, hand sanitizing facilities, minimum cash transaction, that was also explained in these guidelines, pasting posters and instructions, not allowing employees with the symptoms, and promote namaste as a greeting. This happened everywhere in India, I know, but this is based on these guidelines. Then constitution of COVID-19 cells in various departments. Transport department, tourism department, higher education department, general education, local self-government, civil supplies, food safety, Kerala State Electricity Board, Water Authority, Women and Child Welfare, IT, Information and Public Relations. So clear-cut guidelines were issued. That was in 16th March 2020, before the onset of this massive case load in our country. So these were the clear-cut guidelines issued to different departments. I am not going in detail regarding this one, but I must focus on this one, Kerala State Electricity Board. No fines or disconnection shall be imposed on defaulters of payment of bills and under home quarantine, isolation at hospital or treatment. That was a real psychosocial support step taken by our government, because people are in quarantine, they are not going for any work. Definitely there can be chance of defaulting their electricity bill, and no charge were issued from them during that time. Similarly, Kerala Water Authority also did the same thing. Then guidelines for healthcare workers with a secondary contact. That is very interesting, because day before yesterday also we protested for that thing. Initially, if a person gets a secondary contact, he has to wear PPE. Home quarantine if primary turns to positive. Regular assessment and categorization. And after 14 days, test and decide. This was the initial recommendation. But interestingly, last day, we received one guideline stating that there will not be any quarantine time for those who are directly caring patients with COVID. Even primary contact nowadays are not getting, because case load increased considerably. But initially this was the guidelines. Then guidelines for routine vaccination, because vaccination was in full swing. What can be performed? So stop vaccination was the first guideline in all subcenters. Continue with the birth dose of BCG, and hepatitis B and OPV 0 dose can be issued. This was the guidelines initially issued. The interim treatment guidelines, that was in 24th March. How to do this lab investigation, how to categorize individual, how to identify high-risk patient, what are the treatment modalities possible, how to manage cytokine storm, use of tocilizumab, so antiviral medicine, then lopinavir and retro. How to use all these things. Clear-cut guidelines were issued at that time. I'm not going in detail regarding this one. Identification of risk. And this is the evidence-based. Based on this evidence, our government started with the tocilizumab for COVID patients. And studies were there. And based on this study, they started this one. Actually, this study was from Chinese area. And this is the algorithm for case management. Then pregnancy and labor room management, clear-cut guidelines were issued, because that we cannot postpone. That is why clear-cut guidelines, how to manage labor room, how to manage pregnancy, all these things were included in the order that was issued in 24th March 2020. And guidelines for dental clinics. That is another important initiative taken by our government. Limit the procedures, precautions as per guidelines, screen respiratory symptoms, mouthwash before procedure, either hydrogen peroxide or povidone iodine, then rescheduling appointments. These were clear-cut guidelines were issued related to dental clinics. Now, Government of India, based on that, Government of India release related to converting hospitals into COVID hospital. Kerala government also adopted the same principles. Because we know severity of disease can be mild, can be number of individuals affected with the mild symptoms are very high, moderate little bit more, little bit small, critical is very small. But the resource requirement for critical ill client is much high. So these conical figures will tell you where to focus, how to focus, and when to focus while caring a person with a coronavirus. Mobilization of human resources, because as the time progressed, number of patients are increasing, number of healthcare professionals are not increasing. That is why we categorize the individuals into three: group in action A, B, C. Group in action A, group in reserve, and group in quarantine. In rotation, they were made to care a person affected with COVID-19. This is our hospital, and this is the main activity that is carried out by our hospital and our nursing college faculty. That is MCH Thrissur. Training is giving. Our faculty members are divided into 5 areas. One is for training, because as I told, volunteers are getting training. Then COVID brigade, that concept is there in Kerala. That is, a brigade is formed, a group, a team is formed from medical officer to last grade. Even volunteers are included in that one. So clear-cut guidelines are giving. And more nurses nowadays are getting recruited for caring person with COVID patients. So for those individuals, training is carried out in full swing. Our faculty members are involved in this training program. Then contact tracing. Nowadays, main problem what Kerala is facing nowadays is only unidentified contacts. A large number of people daily getting infected from unknown sources. Even the known sources are very difficult to trace out. So contact tracing is a tedious process, and our PG students as well as our faculty members are fully involved in this contact tracing activity, both in district DMO's office as well as in medical college hospital, infection control. One of our faculty member is in charge of this one, and she is taking care of this infection control activities taking in our medical college hospital. Reporting. Daily, we need to report all the happening by 4 or 5 o'clock, so that briefing is possible. So perfect reporting is the hard code of COVID management. So in that also, our faculty members and students are involved. Only PG students and our faculty members are involved. Then psychosocial support and counseling that I already explained. So these many activities are carrying out in our hospital, and this is the layout of our hospital, where we can see different floors are there, where these patients are taken care of, and depending upon the seriousness of their condition, they may be keeping in different floors. Then guidelines for cloth mask. That was the guideline issued by our government in 6th April 2020. Why cloth mask? When to wear this cloth mask? How to wear? And what if all those things are included in that guidelines? What we need to do if I feel breathless? What I have to do when I drink or eat? What will happen if it slip off? All those things are clearly mentioned in this one, and this is mainly for public who are using this cloth mask, and that much stringent effort was taken from the part of this health department. Then guidelines for using rapid test kit. That is nothing to do with our when to do, how to do, and which are the laboratories that we can approach for doing this rapid test. All those details are included in this one. Then guidelines for testing community spread. Now Kerala is facing this problem, community spread. And based on this government order, clear-cut guidelines are there, how to contain, how to manage this issue. For that, triple lockdown like strategies were effectively using in many parts of our state. Then this is the standard treatment guidelines, critical care medicine prepared. So clearly it is mentioning what are the what we have to do with the airway, oxygen therapy, endotracheal intubation, difficult airway algorithm is included in that critical care guidelines, circulations related issues, disability, then high flow nasal oxygen therapy, non-invasive ventilation, invasive ventilation. All these things are clearly mentioned in that guideline. So nobody has to worry about if he is getting posting in a COVID hospital nowadays. Clear-cut guidelines are there. Only we need to follow that one, and clear reporting system is also effectively performing our state. Then restarting universal immunization activity. We cannot postpone this immunization activity for a long period. So government stepped back from that initial decision and started this universal immunization activity, and clear-cut guidelines were clearly mentioned in this order. As per this order, nowadays clinical universal immunization program is effectively carrying out. Then selection of laboratories for antigen. Initially, very few laboratories were performing these investigations. Now, based on this order, clear-cut guidelines are there. Based on this one, antigen testing is performing in many laboratories across our state. Guidelines for ensuring TB services. Another important area government has to focus. So based on this one, how to do if a TB patient who is on anti-TB medicines are getting COVID. So clear-cut guidelines are there, and based on that guidelines, those who are working in these TB centers can effectively manage such condition. Then guidelines for using truenat test. Then clear guidelines for care of ophthalmic patients. That is another important area that was left behind because of this COVID infection. Nobody was going for this ophthalmic care and ophthalmic hospitals because that was the propaganda initially. If you go there, but clear-cut guidelines are there, and clear-cut, based on this clear-cut guidelines, patient can go to ophthalmic hospital and get treatment. And that this is the order which explains about these guidelines. Then revised support guidelines for patients affected with the COVID. That is also based on this order. Railway surveillance guidelines. That is an important guideline that was released. That was in 14th May. That was the time the migrant populations were restless across the country, and they want to move to their own hometown. And many are coming back because they are losing their job. So somehow they need job. That is why they're coming back. So there can be some shuffle, or there can be some turmoil in railway stations and all. And for that, clear-cut guidelines were issued, and that was effectively implemented. And this is the order that explains. Then guidelines for performance appraisal of COVID hospital. Initially, nobody was expecting a quality because nobody was aware about what exactly is happening. But later on, government understood importance of maintenance of that quality. So quality assurance is a major concern. For that, clear-cut guidelines issued. What are the guidelines to be followed? How to assess this quality? So that is based on this order. Then guidelines for cancer care treatment. And Regional Cancer Center in Trivandrum is a major cancer treatment hospital in the country. And many are even coming from outside. So clear guidelines were issued so that patients on active treatment, how to manage a patient on active treatment, how to manage a newly diagnosed patient, how to manage a person who is pending with the radiation, how to manage a person with the chemotherapy, how to manage patients who is in hospital, cancer patient who is in COVID hospital, and how to manage interstate patients and interstate COVID patients who need cancer treatment. Clear-cut guidelines were issued, and that was very much effective for controlling or managing issues related to cancer care. Then guidelines for drivers. Clear guidelines were issued, that is also effective. Guidelines for students who are appearing for examinations, NEET examination or KEM examination or all those competitive examinations, and based on these guidelines, it was carried out effectively, uneventfully. That is also very important. Then guidelines for plasma therapy. Initially, there was some turmoil related to whether to use this one, whether we will get the permission. But successfully we could do this plasma therapy, and based on the clear-cut guidelines issued by the government, that was in 27th May, nowadays plasma therapy is effectively using. Then guidelines for prisoners. One of the major issue that we faced initially was COVID infections among prisoners. So clear-cut guidelines were issued how to manage a prisoner who can get this COVID, or who is coming as a new prisoner. How to manage all those things are based on these guidelines. Assessment of district surveillance unit. This is a major step taken by our government to ensure how these activities, how these orders are implementing effectively at district level. So that is based on this order. And revised guidelines for testing and quarantine. So as they progressed, how to conduct these investigations and all. That was in 3rd June 2020. Then community surveillance using rapid antibody. For that, 5 groups were identified. Community surveillance. First group, that is healthcare workers. Second one, government officials with the public contact. Third, people in quarantine. Fourth, elderly who are vulnerable. And group 5, patients with the general population or epidemiological sample. So community surveillance was based on this priority. First priority was for these healthcare workers. And even now it is carrying out effectively. And this is the functioning of CFLTC. Each COVID hospital is attached with 4 or 5 CFLTCs, and patients will be caring in the CFLTs. Based on these parameters, they can be transferred to COVID hospitals. So that is effectively performing nowadays. And this is one picture of a CFLTC in our district. Clearly, guidelines are issued in that CFLTC prerequisites mentioned. Administrative details explained, duties and responsibility from the medical officer to all categories specifically mentioned in that one. Admission criteria, triaging and registration, assessment protocol, patient responsibility, telemedicine, infection control, psychosocial support specifically to that CFLTC, diet, capacity building, registrars report, and all committees. All these things are included in that guidelines specifically meant for this CFLTC. Then revised discharge guidelines. When to discharge a person, clear guidelines are there, and based on that guidelines, it is uniformly performing across the state. Then Sentinel Surveillance for the coastal, slum, and tribal areas. That is effectively performing based on this order. And human resource polling, very important. Very recent one, that is in 24th July 2020, as per this order. Different categories of individuals are nowadays pooling. For that, we can have a pool of professionals to compact with if the number of cases increased much more than what is expected. So that pooling is based on this government order. And healthcare workers pooling, this is happening. And this is a very recent photograph. See how many are continuously doing. So definitely we need human resources. That healthcare pooling is effectively implementing. From that, so many lessons I could learn. Around 8 lessons I could learn from these many months while associating with COVID fight. Lesson 1, warlike preparation required on healthcare front. Future healthcare systems should be war prepared to battle pandemics whenever they break out. We have near complete knowledge on tackling major killers like heart ailments, cancer, lifestyle disease, AIDS, etc. But specifically, I am stressing, but not a virus. We need to learn a lot related to virus. Lesson 2, we need to set early warning system in place in the society. Unlike in the past, viruses in the 21st century not only are hyperactive, but also leave their tail of devastation with viral speed. This is because of globalization. Actually, the problem right now Kerala is facing this thing. Viral speed that is much higher compared to anywhere in the world, because we are really connected with across the world. So that globalization is the end result of this globalization can be this viral speed. Lesson 3. Social distancing should be become a norm, part of our regular habits. When a new virus comes to knocking, there should be a self-imposed social distancing to break the chain. Even in the absence of a virus, it is better to observe social distancing as a part of life. Intimacy may be good and may reflect part of one's own culture, but distancing without offending the other is the best. Lesson 4. Swachh Bharat should become a norm for 100% Indians. India has to evolve a mechanism to maintain hygiene and cleanliness. For this, the urge should come from within. Nobody should impose, it should come from within. Parts of our cities, towns are buried to the nose with garbage and filth. This has to end. So, to our unbridled drive to pollute air and water in the name of economic progress and gain. Lesson 5. A guideline for at-risk people, elderly and patients with the comorbidity should be in place and in practice. That is very important. We can have n number of guidelines. If it is not practicing effectively, it is of no use. So there should be something in place and it should be practiced. Whenever there are signs of a pandemic, India should be able to isolate the elderly patients with comorbidity and children who are either underweight or malnourished. Two population we need to focus: elderly with comorbidity and undernourished children. If we can isolate them, viral disease like this will not be an issue. So that is our main target. This is one lesson what I learned. For this, what is the paramount important is the robust health surveillance system at the state level and a constantly updated registry of population on a national scale. That is important. Unless the vulnerable sections are pre-identified through strong data collection, states and nations would be only invite trouble, but also leave the doors wide open for virus to enter. Lesson 6. Need to promote our drug vaccination development program further. It has shown the world strength of our pharma segments. India could export life-saving drugs to major countries, including developed countries. Lesson 7. Push our indigenous diagnostics manufacturing to make it sufficient for Indian needs. COVID-19 has exposed India's unpreparedness in having rapid testing kits and PPE. That was the initial lacune we could see. Number of testing kits and of course PPE. There are cities like Tirupur in Tamil Nadu. They can very well contract this, overrule this issue of PPE that we have to work out. Lesson 8. Our government need to make appropriate provisions for supporting the BOP population below the poverty in case of such calamities. A pandemic always hard knock and down economics world over. I bet this will be the worst year for economy, I think, for 100 years. Take home messages, early response, effective command, whole of government, and strong political leadership ensure focused and coordinated action. Existing laws provide legal framework for control activities. Evidence-based strategies to reduce viral transmission worked for a shorter time. Understand the impact of controlled movement of migrant population. Pan-India laboratory networks are essential and must be sustained. Protection and preservation of vulnerable senior citizens is our prime aim. Frontline workers need protection and infection and ignorant. We need to protect the frontline workers. Public engagement is the key to contain COVID-19 pandemic. Responsible role of mainstream and social media is crucial. Encourage R&D at national level and participate in global research activity. One health approach for early detection and control of a pandemic. And most important thing is mathematical models fail to predict the biological
Hello.
Uh, there was a problem with our power supply. Sorry.
No issue, sir. We will wait.
No, actually I finished. No issue. Thank
Okay,
you.
sir. You want to conclude, sir?
No, with that one I am finishing. No issue.
Okay, sir. Thank you so much.
Hello.
Yes, madam.
Thank you so much, Dr. Riaz. It was an really mind-blowing session, and a lot of initiatives are taken at the government level, which you brought on the stage, and everyone we come to understand. So, what are all the difficulties and the initiatives are taken at the government level, and even like each department. You were telling, so really it was a very wonderful session. I thank you so much for accepting our invitation and giving this wonderful session to our participants. Thank you so much.
Thank you, madam. So I would like to
Thank you.
extend
Thank you, ma'am.
the
Thank you, ma'am.
thanks to Dr. Riaz K.M. sir. He has explained the topic in a very well manner that he started with a government initiation to control and manage the COVID-19. He began with a frequent meetings of Department of Health and Family Welfare, Education,
And I would
and
like to thank our organizing team, organizing secretary, Mr. Navina, and the members, Ms. Shika Gulia and Ms. Mamta Chauhan, for their tireless effort for organizing this webinar, and continuously they are working and coordinating with everyone to make this program very successful one. Thank you everyone,
All the best.
and
All the
thank you
best for your
to the
future initiative
participants
also.
also.
thank
All
you.
the best for your future initiative related to
Thank
this
you, sir.
area. Thank you.
Sir, please don't leave. We have some question and answer
Oh,
session.
sure.
Okay. So I would like to say thanks to Dr. Riaz K.M. For explaining government initiation to control and manage the COVID-19. So he began with the frequent meetings of Department of Medical Education and Health, and also he discussed on contact tracing, quarantine, and Riaz sir has redefined a migrant worker's name as a guest workers. I would like to say thanks to you, sir, because the first time I am hearing this guest workers. This is a good approach. And also, sir explained various guidelines in sectors like algorithm for suspected cases of COVID-19, criteria for hospital-based activities, state-level coronavirus control room, animal husbandry, tourism department, flight and airport management, and also he explained National Task Force for COVID-19 by ICMR, and also he explained regarding HCQ chemoprophylaxis, guidelines for salon, beauty parlor, shopping malls, healthcare workers with secondary contacts, regarding pregnancy, labor, cloth mask, universal immunization activities, laboratories for antigen testing, TB services, railway service guidelines, performance appraisal, cancer care treatment, prisoners, community surveillance, etc., etc. And finally, he explained 8 lessons at this moment. What are the lessons we have to learn and what are the take-home messages? So, sir, it is, I can say, sir, one of the best class I have heard in the webinar. Thank you so much, Dr. Riaz, sir. Dear participants, delegates, you can ask your questions. So now I have a list of questions, sir. If you are ready, we can start, sir.
Yes, definitely.
So Miss Disha, Miss Enna Kadian has asked the question regarding what is Disha in category B.
Okay, Disha is the website services, online services available for individual affected with COVID. Even public can call this. It's a call center facilities that is initiated by Government of Kerala Health Department, and Disha is that online center call center where you can ask any questions related to this one. Even your issues related to other area also you can ask. They will intervene. That is the platform. And category B is the categorization is the category is asymptomatic but positive. Category B means individual is affected with the COVID positive, but symptoms are minor. Whereas in category C, it is much higher. They need intensive treatment. That is a categorization according to that guidelines. Thank you.
Thank you, sir. I think Miss Enna Kadian has got her answer. Okay, next question from Praveena Mahadalkar. The question is, what is the latest guidelines for healthcare workers, especially over age 50 and with comorbidities?
In Kerala, there is no restriction for no age bar is there for caring patients with this patients affect. I mean, individual affect. There is no age bar for healthcare workers. So there is no specific guidelines so far available for individuals in healthcare system.
Indeed, it's a good question. The government can
Yeah,
think
we
about.
have to work on that one definitely.
Yeah,
So
yeah,
eye opener for me also.
Okay, so next question from Nisi Preetham. Sir, what is the opinion regarding the vaccine? Is it possible early?
Yeah, I think our government is really working hard to get this COVID vaccine in practice. Definitely, our government will come with a fruitful solution. I hope within 6 months I may get, because while interacting with medical professionals, I get that feedback that in our team many doctors are there, and they are telling that this vaccine is possible, but it may take a minimum of more than, I mean, up to 6 months it can take. That is the concept I too have.
So I think we only get from Indian-made vaccine.
Yeah,
Is it, sir?
exactly. We can do, sir. That is why our pharma industry is too strong, that we proved a lot thing. And this COVID could really could help us to identify our strength as an Indian. Definitely, we will feel that one.
Okay, made in India vaccine.
Yeah, exactly, sir.
Okay, sir. Next question from Praveena Mahadalkar. What is the latest guidelines regarding the PPE kit in various areas for the healthcare workers? Example, COVID, non-COVID, and community.
In community, there were no need for this PPE kits, and for asymptomatic patient also. I mean, for patients, we need to use the PPE kit. In hospital, in our COVID hospital, every patient is dealing with this PPE kit only. In community, we need not use this PPE kit.
Yes, sir. Thank you so much. I think we have answered almost all the questions, sir. One more question we have got. Mr. Saurabh Chakraborty asked a question. Sir, how to educate people regarding management of stress and anxiety during this uncertainty period?
Yeah, I will give you some tip regarding that. If you remember COVID, you can fight stress and anxiety. So C for connect with God and connect with everybody. C. Clear?
Please
Oh,
come again,
C.
sir. Sir, please, because we did not get voice.
Yeah, I think our internet, my internet.
COVID, sir.
Okay, okay, COVID.
Uh,
C for connect with God and everybody. Connect with God and everybody. C. O. Observe. Observe yourself and observe the nature. So C. O. Next one is V. Volunteer yourself for activities for others. Can you hear me?
yes, sir. Yes, sir. Volunteer yourself.
Okay. Okay. Volunteer yourself. I. Involve in physical activities or exercise. And D for diet. Maintain a healthy diet. So this COVID will help you to resolve your stress.
Very good explanation, sir. I think Saurabh will adapt these all COVID
Just adopt
mantras.
COVID so as to reduce your stress.
If we can rename it as COVID mantra.
Yeah, exactly, sir.
Okay. Sir, one more question.
Yes, sir.
Sir, how to educate people? Sorry, next question from Praveena. Is there a death audit done for healthcare workers' death?
Yeah, in Kerala, there is around less than 30 people are all, less than 20 people are affected with this one, as they encountered with this death. And the number of people affected with this one is very comparatively less in Kerala.
Okay. From Ankita Gorai, please, sorry. Yes, sir. I think we have completed the question. Thank you so much, delegates and participants, for your active participation. So you are very active listeners, and also I think Dr. Riaz sir has cleared all your doubts, I feel. Now I would like to hand over the session to one of the organizing team member, Miss Shika, for vote of thanks.
Thank you, sir. Believe I am audible to all of you. Thank you, sir, for handing over, and thank you. Good evening. Very good evening to all of you. Good evening to respected principal ma'am, our eminent speaker of today, Dr. Riaz, our faculty members, and our very dear delegates. It's my privilege to have been asked to propose a vote of thanks on this occasion. And I, on the behalf of Amity College of Nursing, Amity University, extend a hearty vote of thanks to all. I extend my warm thanks to Principal Madam for her enormous cooperation, guidance, and support in the organization of this event. And we are very delighted and we are very extremely grateful and fortunate to have Dr. Riaz from Government College of Nursing, Kerala, as our eminent speaker for the day, for gracing the webinar and sharing with us his profound knowledge and understanding on the government inventiveness in management of COVID-19. We also extend our best wishes to you, sir, for extending your enormous support as counselor, which is most needed in this pandemic. And sir, thank you so much for simplifying for us, for our delegates, about the mapping, about the handling of COVID-19 outbreak by the government authorities. And a big thank you to organizing team, the very enthusiastic team. My sincere gratitude to Mr. Navina, sir. He's the organizing secretary for this webinar, and for his untiring effort. Ms. Mamta Chauhan, madam, Mr. Rajkumar, and for his IT support, and the IT team for their constant IT support. I want to state wholeheartedly that we are all most grateful to all the faculty members, our delegates, especially our speaker, Principal Madam, and for all who have joined us for the webinar. We are looking forward for our tomorrow's virtual meet now. Thank you very much to all of you. We wish you all a very delightful evening for today. Thank you.
Thank you so much.